Good afternoon, everybody. My name is Mandy Baker, and I'm super excited for you guys to be joining us today. We're excited to kick off today's call. With that, I'm going to pass this call over to our founder and CEO, Reed Rasmussen.
All right. Well, glad to have you here. We'll give you a power-packed half hour, and we're going to talk about how you can guide conversations like grabbing onto the three challenges of today's hybrid and remote workforce and the issues that employers are dealing with right now on hiring, and how you can use that to guide and help you with prospecting on some new groups, and also for reorienting and bringing new solutions to some of your existing groups with three hybrid and remote solutions. So that was Mandy Baker. For those of you that don't know Mandy, she's our account executive. So if you've got some existing business that's at all sizable with us, Mandy is your go-to expert for helping you through that and guiding you through those renewal conversations, maybe some training. Charles is all of a couple weeks in with us. He's a broker sales executive working with those of you who have at least some larger group business, 100 lives and above. If you've even got some of that on your block, and you are outside of Texas, you'll be in Charles's territory, and myself. So they'll be here. If you have any questions, by all means, use the chat. But we've got a lot of content here, so I want to plow on through. The three of us last week, we were in Carlsbad, California for the Benefits Pro conference. And on Monday and on Tuesday and on Wednesday, we had somebody who said to us, I am so sick of just talking about COVID and the illness of it and what it means, or the actual illness of it. And they were tired of being cooped up, and they were tired of last year, so many employers just saying, hey, we're going to hunker down and we're not going to make any changes. Whatever advice you give me for benefit plan changes, we're not going to take any of it. We're going to just sit with what we have. And just because that's the conversation from this last year doesn't mean that you have to live with that. And if you read any great books like The Challenger Sale, it says you've got to change the conversation. You've got to bring new insight to your employers to bring value. And if you haven't read that book, order it immediately. It is a fantastic book. And another one that's very good is you flip the script. So you got to flip the script on this conversation. And we're going to help you shift that conversation by focusing in on the workforce challenges that those employers are now dealing with today and bringing those three solutions. And we'll bring you some discovery questions to really help you. How do you talk about these solutions as a strategy instead of just talking about them as a product? And where to go with this on next steps. So remote workforce, right? Pre-COVID, 16% of the country was working remotely. Post-COVID, 73% of people wanted flexible options in their work. That means 3 out of 4 people want their employer to do something for some remote work. This is coming from a Microsoft 2021 Work Trend Index that was done in around May of this spring. And there's really 3 specific challenges that the remote workforce is bringing right now. One is employee stress is at a breaking point right now. 1 in 5 employees in this survey said, hey, here in 2021, I do not believe my employer is sympathetic to what I actually am dealing with at home. And you look at the stress levels that people dealt with over this last year, and you understand why we're in the worst mental health state ever as a country. 54% of people are overworked, 39% are exhausted. And hey, there were so many people that were forced into a work environment last year that wasn't just a calm remote workforce. Like it was immediate. So many people had to learn the technology, and all of a sudden, they as well were being working remote, trying to keep their clients happy, wondering whether their company was even going to survive, becoming parent and teacher 24/7, being a caretaker. Like the stress levels that we've been dealing with are huge. At the same time, partly as a result of that, in May, something happened that the Wall Street Journal has dubbed the Great Resignation. Never before in the history of America have 4 million people quit their jobs in a single month, but it happened in May, and it continued in June, and it continued in July. People are saying, hey, listen, I don't even buy into what the company's representing. I don't like the way that you treated me over the last year. You didn't really care for me and my work environment. I think I'm going to just go figure out what I'm going to do when I grow up. Pair that with the fact that as a result of both of those things, now that companies are saying, okay, we're coming back to full-time work, a lot of people are refusing to come back. They're saying, hey, if I have to come back 5 days a week, I am not going to do it. You got to give me 2 days back at home, 3 days. People are looking for this hybrid kind of work environment. And so employers are, and I don't make this as a light statement, employers are freaking out right now. If you got any employers who try and actually recruit people, we have never seen it like this. Or actually just hold on to their people and have them not leave on retaining people. Never seen it like this. And then what about all the people in between? Are they set up to thrive in that work environment that we're in right now? And it is, this is a conversation that we're hearing out of brokers and employers all over the country. And what I have been asking in the last couple of months that I've been talking to different people is whether these are issues for them. And it's come up in about 80% of the conversations I'm having these days. And so what we wanted to do is say, okay, how do we take that, which if it's such a hot topic and such a strong need, how do we take that as a group of consultants and the concern now of, Delta variant coming in, how do we take this and turn it into a flip the script and be a challenger, bring a new insight with questions like, how does your benefit plan show employees that you're supporting a hybrid and remote work environment? This is exactly what you want to be able to do. So it's a great question when you think about talking to prospects, right? Like, oh, what has your current consultant done to set up your benefit plan? Oh, well, if not, let's make some shifts. And it might not be giant shifts. It might not be change out all the medical, all the dental, all the life insurance. It might be some tweaks with a few tools, but a very important set of tweaks. And so having that conversation with your prospects seems real easy. I would say, and I would warn, don't skip this conversation with your clients. Don't think that it's your responsibility that 2 years ago when you made their last plan changes, because last year they stayed steady, right? That they would have even been looking for these things. So don't ignore your current clients. It needs to be part of that renewal conversation as well, right? So where do we go with this? Well, let's jump from the workforce challenges. Can you start the conversation there and then roll into some solutions? And we're going to talk about 3 specific solutions. The first of those is advocacy. And advocacy does a lot of things, but an employer isn't going to say, hey, you know what I need? I need advocacy. So they're not going to ask you for this. And if you go to them and say, hey, do you want advocacy? If you went to them and told them what the services are and said, hey, here's the top 6 things that an advocate does. They find highly rated providers. They help you schedule your appointments. They help you pay less for healthcare. They help you get simple answers on benefits. They help you save money on prescriptions, and they help resolve medical billing errors. Honestly, some employers would purchase just based upon that description. But as we look at it, honestly, a lot are not going to buy just because they heard that definition. And rather, you need to lead the conversation a little bit differently. And the one thing that I would say that is important to recognize here is how our advocates are able to have access to this. Because some of these are things that you and your support team do and you want to do and you can do some of them. But our advocates have an advantage, and that is over the last 15 years, them being in business, they have built a huge proprietary database tracking pricing and quality stats around the entire country. And you don't just casually go into this. There are a few companies that have done a fantastic job on this, and our advocates are certainly one of them. And what they've done is they started with that Medicare and Medicaid data, that public data that they can get their hands on pricing. And then they merge it with some of the quality data, things like health grades and the Leapfrog group, some of these different entities that look at quality of providers. They merged it in with all of their own client data with millions of members' data on the books for 15 years. And then they've bought national databases. And you can do things like, if you're an entity that big, you can buy de-identified claims data from the entire Blue Cross Blue Shield Association and then have it down to a zip code level so that every single client you have, if today they called you, let's say half the people in your entire book of business called you this month and said, hey, I need to find my best quality doctor in my area that's on my plan, that's got my personal preferences, and that are taking new patients. could you even answer them? You'd say, hey, call the carrier. And they'll ask the carrier, who's the best quality physician? And the carrier's going to say, well, we're not going to tell you that, but we'll tell you who's on the network. And that's their level of transparency that we provide as an industry. But our advocates here, they can do that, and they can turn that around in a 24-hour period for any of your members. So a picture's worth 1,000 words. Let's say they went to them and said, hey, I need an MRI today. I mean, we use it as the most common thing today that you'll say, hey, here's a good example of a service that you should shop for. Except if you've ever tried to shop for an MRI, the MRI companies don't make it easy, but instead to be able to get delivered this plan that says, well, in McKinney, Texas, my hometown, on your plan, here's the rates that you would pay. And that the one on the left is about $500, and the one on the right is going to end up being about $1,300. Or what about a surgery? So let's say you need a colonoscopy. Here's 3 providers that are on your plan in your town. They can all see you within 2 to 3 weeks. Here's their health grades rating. And by the way, the one on the left is going to be about $2,000. And then the one on the right is going to be about $3,300. That's powerful. And it's what so many members are looking for today, because everybody who's touching the healthcare system are confused and feeling out of control with it. And are we making a smoother experience for people? Because it's what Americans are asking for. But like I said, you're not just going to ask, hey, do you want advocacy? But here's your leading questions. So the first one is, how does an employee figure out what doctor to use or where to get a surgery done? Again, great to think about when you're prospecting, right? To be able to ask, okay, what is your current consultant set up so that how are they guiding your people to the best quality and best value providers? And you pause and you wait for the crickets, because you know darn well that current broker has not installed anything like that. It's a tremendous power question. Second one, do your employees engage with the full variety of benefits you're providing? You know, in the smallest groups, everybody knows what their benefits are because it's 1 or 2 or 3 things. You start to get mid-size and larger. There's a lot of different tools that have been made available. Who's home base for that? Is it just the HR director? An advocate is able to keep an eye on all the benefits available and guide people when they're talking with them to other services that are available. Like, let's say somebody was calling in about a bill. They know that the advocate hears that they're stressed over some stuff, and they go, hey, by the way, do you know you have an EAP over here as an option? You know, you've got behavioral telehealth over here, and they can guide them to the various pieces. Or the third question, when an employee has an issue with medical claims, how do they handle those? Pause, if there's no answer. Who do they go to for help? And if you're talking to an HR director, maybe that person on the team who everybody knows is very motherly and she takes care of everybody's issues. They come in and bring her their stack of EOBs and ask for some help on it. If you're talking to that person, probably they're going to put up their hand and they're going to say, they all come to me. Now, let's be honest. Most people didn't, and they're just mad the fact that their bills don't make sense and their claims are issues or haven't given them issues. But she might handle some of them and then might deliver some of them to you as the broker that were beyond what she could do. And instead, being able to say, listen, we're going to make you a hero and you're going to be a hero to your people, because let's get that work off of your plate. You're saying that to HR. Hey, to those of you that are listening on the line, let's also get a lot of those calls off of your list of work to do, because the most complicated ones the advocates can handle. So I hope that helps see how this one strategy, if how you might guide the conversation a little bit during a discovery call or a renewal call with a given client. The second category is telehealth. And, you know, we were in the telehealth business. We've been in this line of business for 12 years. And it's been fantastic to see it run. It was fun in the early days when nobody thought it was even legal. I thought we were late to the party in 2009 when we first started working in telehealth. I thought it was going to be wrapped up in a few years. Until the pandemic hit, there were still a ton of Americans that weren't clear on how to make use of it. And then last year, on a single day, the country said, shut down everything, use telehealth whenever possible. And if it has anything to do with COVID, it's going to be free. People loved free, and so a lot of people tried it. Plus, it was the only place to go. The world's opened back up again. The plans stopped doing free in most instances. There's only a few medical plans in most of the states of the country where there's even an option that has some free telehealth on it. If there's free telehealth on a medical plan and people are using it a lot, then they should use that. But here's what we know. In most instances, people are dropping using telehealth because there's a visit fee attached to it, and they're just going back to seeing their doctors. Whereas under our program, telehealth is zero visit fee for those primary care kinds of visits. And in this environment where we are searching for tools that help people in a remote environment, a repositioning of telehealth in a slightly different way paints a perfect picture of it being a tool for remote and hybrid workforce. So Heidi Rasmussen here on the right-hand side was doing an interview with Alexandria Murphy, asking about her employee benefits. This was an interview from a couple of weeks ago. And here's what Alex had to say.
The service that my team loves is the virtual part. That's what everyone raves about. They absolutely love having that. No one ever comments on the insurance. And this is the one product that I've had probably 5 or 6 people mention that they love it. It's so easy, that it's great. You know, you don't have to pay, like go in and do a copay. It's the one thing in all of my time with my team that they've ever mentioned positive about insurance and about and they're, I asked and they said, anytime I've used it, it's always been very positive. I was very satisfied. Another team member said, I've used this for my kiddos. It's so quick and easy when you don't have time to go to the doctor's office. So just that for things like a sinus infection or, maybe a UTI or pink eye or something that you kind of know what's going on and you don't want to go in and pay and take the time and be around sick people. And now with everything going on and, you want to avoid that. Everyone loves it. It's made it so easy. And these are employees all over the country. So like California, Texas, I think Michigan maybe. So it's not even just location specific. And it really is such an easy, friendly very client-friendly user experience. And when I look at the cost of everything, it's even very expensive. Like it's very, very fairly priced. So we couldn't be happier.
And see, that's what you'll hear out of somebody when your telehealth usages are huge. You hear that kind of statement where we're getting testimonials all the time. This is the only thing that they aren't even talking, like she said at the beginning, they're not even talking about health insurance with us, but they mentioned this unsolicited. And she has a virtual workforce. They are movie theater installers all over the country. And that's her workforce. Here's what I want you to notice that she didn't say. She didn't say, hey, I heard there's a telehealth inside my medical plan. We're just going to cancel this because it's bringing no value. We're going to use that over there instead. And the reason that she's not is because she's getting great usage and it's making a difference on the culture of their employees. And that's no small thing. I want you to think about that. The telehealth that's inside the medical plans when it has a visit fee attached to it, it's like the spare tire in your car. Like it's there for emergencies. What was 2020? 2020 was a time of emergency. That plan was okay there. Zero visit fee is a real tire for your car where you're actually going to use it and use it all the time. So how do you guide towards this as by leading questions? So here's your power questions here. Mr. Employer, how are you limiting the number of unnecessary emergency room and urgent care center trips after hours and on weekends? Huge driver of unnecessary claims, right? And if you're on fully insured, it is a cost that is going straight into the member's checkbook. And if you're a self-funded plan, it is going straight to the bottom of the line of the employer. Second question, what's the usage level of your current telehealth program? When you ask that, probably 8 times out of 10, you're going to get, I don't know. If they don't know, it's less than 10%, like probably way less, even today after people getting used to it last year. The average inside the industry of standalone telehealth is 7%. Average when it's inside a medical plan has been 1 or 2%. And the threshold here, one of the questions is it dropping as visit fees have come back? Yeah, usage levels are dropping under all the medical plans that used to have it for free. The threshold you want to listen for is 40%. So if it's not at least 40%, somebody might go, I think it's pretty good. We're running at 15%. Know that we can do triple that with that group just by setting them up on a program that had extra promotion. So I hope that helps a little bit. And then here's a driver. If your people's stress is skyrocketing this year, what virtual and remote tools prove to them that you're concerned about them? And of course, this is leading towards behavioral telehealth, which is included in all of our new plans and is highly discussed and sought after. And that employer, just by repositioning and say, like some of your employers already have it in there, they just didn't even, they don't talk about it this way, but be able to say, hey, we put this in specifically to support us as a hybrid and remote workforce. So I hope that helps a little bit. And then the third category is the tools. And the tools for us, sometimes it's our tech tools, sometimes it's our, it's referring to our savings networks that are a part of our standard plans. And if you're working on groups that are below 200 lives, dental, vision, and pharmacy are included in all of those. If you're working on some cases that are 200 plus, pharmacy is automatically in there on those. And it was interesting, we had our broker advisory council meeting last month, and one of the brokers came in and he said, you know, I tend to never really talk about the tools that are inside the Fresh Bennies membership. And he said, I needed to get some dental work done. He said, I can't believe how big that savings was by hitting the dental savings program. And in the FreshFlix videos, there's a video on one of the sections is on tools. And the second video, I specifically tell these testimonials. And on there, one of them was a pharmacy example where a woman drove an extra 5 miles to a different pharmacy, and her drug price went from $93 at one pharmacy to $24 at the other. So she saved $69. The second one was a guy who needed a teeth cleaning and an x-ray, and it was going to be $350. And with his negotiated rate, it came down to $102 by using his membership. So he saved $248. And the third one was an example of somebody was getting some glasses, and their retail price was $424. And after showing his membership, it went down to $219. So they saved $205. So the savings are there, and like that's real cash that you've put back in the hands of people. So what are some questions that you might use as leading questions in this category? Well, one is a question you probably are going to ask when you're doing a discovery meeting with a prospect anyhow, and that is describe your dental and vision insurance offerings. And then the important question, how many people elect them? I asked this question of a broker at Benefits Pro last week, and he said, well, all my groups have dental and vision. And I go, are you saying all of your groups pay for dental and vision insurance for all their people? And he goes, well, no. They used to, 20 years ago, right? But he goes, no, about 10% do that. And I go, okay, of those who don't, and you voluntarily offer, what percentage of people elect dental and vision offerings? And it'll play out in different states, right? And different categories of business that you sell into. For him, he said, oh, about 20%. And I go, well, it's the other 70% of people in your entire block of business who let's at least not have them pay full retail, right? Question number 2, what feedback do you get from employees who elect and don't elect dental and vision? Is it one of those topics where people are talking about it all the time? And then a power question. What benefits are available for employees who don't qualify for medical insurance or those who don't elect medical insurance? Why shouldn't they take a job down the street? You know, we think we've put a benefit plan in place, everybody there is going to retain. At a time like this, when it's so tense on trying to retain employees, are there some benefits that are there for all employees as opposed to just those who elect medical? And Fresh Bennies is a fantastic strategy for you for that. And we're kind of under the radar as a strategy that you can walk into a lot of employers, and that existing broker hasn't done a thing to try to help that category of people. So we talked through 3 workforce challenges. How can you speak to that? 3 solutions and discovery questions that I hope will help you drive the conversation better with your prospects and your existing clients to think differently. And next steps, well, if you haven't already seen the FreshFlix, I know it's not quite as entertaining as Netflix, but we did these 2-minute snackable videos, talked through some of these issues, and the left-hand channel is all on advocacy stories. The middle is on telehealth, and the third channel there is on the tools. There's some good other stories and comments in there. If you watch those and you like this, if you've got some more questions on it, we absolutely can address it. One of the things I want to make you recognize, some of you will say, well, Reed, I like all of your benefits. Sure. Except I just want just one product. I just want a telehealth solution. I just want an advocacy solution. I just want some savings networks. And what I would say is the group that wants some actually needs all. And here's Lance, who unsolicited to us actually before we recorded this video with him a couple of weeks ago. He was telling us all these different benefits that his team is using. And I couldn't believe that this CEO knew our level of benefits this well amongst his 300 employees. But here's what he had to say.
Fresh Bennies is definitely one of the best benefits that we offer. As an employer, it helps people miss less work, which also helps them. It helps us reduce our claims. It also helps save the employee money because they're not having to pay the copay of going to some doctor. Several of our employees have had surgeries and have used them as a resource to find the best doctors. We've also had people use them if you need a CAT scan or anything like that. I mean, the variety of charges that can occur from that is anywhere from a couple $100 to a couple thousand. It's a huge benefit. I highly recommend it to any employer.
What I love is here's this guy who knows this much about just our benefits, and I know his broker, and his broker is a hero. But do you think you could take a BOR on this company with what the current broker has done? And that's half the story for us when we're talking to you as brokers is, are you bringing ideas before your client gets requested them or suggested for them by another broker? So I suggest you talk with everybody about these challenges. Your next steps really talk about it in your renewals, talk about it in your prospects. If you have, like we had the conversation with a number of folks today or this last week, if you had a whole bunch of December group renewals or January group renewals, don't wait until November to be bringing this up. So have propose some of those fresh solutions immediately. And then you can do that by reaching out to any of us on our team to run a proposal or help you figure out what's that pricing or that story going to be. And you're going to have happier and longer tenured members, right? So that's the ultimate goal here. With that, Mandy, Charles, were there any questions that had come in from folks?
Yeah, actually, there's one here that I was just most of them you've already answered, but the list of doctors and prices, how would somebody find out what is considered, available for our discount services for dental and vision?
Oh, for our discount services.
Mm-hmm.
Okay, well, if you're a broker, you should have a Fresh Bennies membership. And if you don't, you can get one either for your whole team. Happy to set your team up with some as a group with Fresh Bennies. Those groups who do and those brokers who do sell 10 times as much. We literally have the date on it, sell 10 times as many memberships because they've got these real stories. So if you've actually got it yourself, you can go inside the app or the member portal and you can do a zero in on a map of in this zip code, where's the closest 50 of them. In most parts of the country, you'll see it strong. The dental is the pharmacy is Argus, the dental is Humana's Dental Access Network, and the vision is the Coast to Coast Vision Network, which includes most of the stores that are out there.
I think that answers that question. And then next question was, can you rename all the books you listed and recommended at the beginning of the meeting?
I sure can. Oh, I'll say this before I jump on. If you're not going to buy a Fresh Bennies membership and you still want that question answered, we'll get you the demo membership so you can at least log in. That information, you have to be in either the demo or a live account. We'll get you a demo. So you just
I'll take care of it. Yeah.
Here's the two books. The Challenger sale has been around for a long time. It talks about if you're just trying to be nice to all your clients, you're not going to have near the results as if you at times are pressing them to show them new ideas. And Flip the Script is by Oren Klaff, who is just fantastic at helping people sell ideas as opposed to tangible goods. And we're at 3 o'clock.
Perfect timing.
Awesome, everybody. Great to see you. Reach out. Let us go to work and help you this fall. Have a great one.